You're listening to the Autism Weekly podcast. Each week, we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Skibitsky. This week, we're joined by Dr. Elizabeth Laugeson, clinical professor at UCLA and founder of the UCLA Peers Clinic, one of the world's leading programs for social skills training for adolescents and adults with autism. Dr. Laugeson is an internationally recognized expert in the field, having developed evidence-based programs now used in over 150 countries. Today, we'll be discussing how Peers is transforming lives by teaching essential social skills. Welcome to the podcast, Dr. Elizabeth Laugeson.
Thank you, Jeffrey. I appreciate being here.
Well, I think that this topic it's one that I feel like every clinician should be listening to. I feel like it's one that every family and every self-advocate should be hearing, because the social skill development and the access to those particular services is one that's limited right now. And you're creating one that I think is going to provide so much opportunity for so many people out there to access needed care. Before we get into that, though, I'd love to hear how your journey started, because we all have our own path to servicing neurodiversity. How did you fall into the field of autism care?
Well, thanks for the question. I kind of fell into the field in a less obvious way than other people. A lot of people expect me to say that I have a child on the spectrum or a family member. Actually, there's a saying in research, because I am a researcher as well as a clinician. There's a saying that research is me search. If you're really passionate about something, there's usually a story there that is more personal. And that is true for me as well. I, by the age of 24, had lived in 21 different places. And by the time I got my doctorate, I'd gone to 14 different schools. And
Oh,
so
wow.
you can imagine like having to move around a lot. I really had to learn how to decode my social world. I mean, my social world is constantly changing, and I needed to figure out sort of what were the rules wherever I happened to be. And it was something that I learned to do, fortunately. And so as a psychologist and training and working with youth with autism and other sort of neurodevelopmental disabilities, recognizing the challenges that a lot of these young people faced in the social world was really exciting to me, in that I got it. I understood what they needed. And I'd been there where I was also confused by my social world and having to figure it out and navigate. And I thought, oh my goodness, I can help them. I know how to do this. And so that's sort of my personal journey into the field of autism, and really this personal experience of really being able to relate to some of the challenges that they face.
Yeah, and when you're talking through that, I feel like every guest that I've spoken to, they talk about the normalcy of almost every one of our interventions. It's that, it's not necessarily always unique to a population. It's not always necessarily unique to a diagnostic condition. We all benefit oftentimes from each of these strategies that are put out there. It's just to what level or what focus or what priority is out there. How did the Peers program get developed? Because that is unique. It's unique to a very special population. How did you start going down that path specifically and breaking down those barriers?
Yeah, so that's more the professional story. The other was the more personal. So I was at UCLA doing a predoctoral psychology internship in neurodevelopmental disabilities, and I was working on a CDC-funded study with kids with prenatal alcohol exposure, so fetal alcohol syndrome. And it was a program that was teaching friendship skills. It was a parent-assisted program, and this is for school-aged children, like elementary school-aged. And what was interesting about this study, and again, kids with FASD, they struggle with social skills just as do others, like including those on the autism spectrum, but in a different way. They tend to be more socially indiscriminate. This would be like the kid who would come up and sort of hugs a stranger. But they were struggling socially, and this program was really helping them to develop friendships. While we're doing this study, the phone is ringing off the hook from parents of teens on the autism spectrum. And they know that our study is not for their kid, but they're just wondering, do you know of anything in the community? So this is back in 2003 in Los Angeles, which is a pretty big metropolitan area. We had nowhere to send them. There was nothing out there. There were no friendship programs, social skills programs for autistic teens at that
Mhm.
time. And I thought that was just unacceptable and really wanted to fill that gap in not only services, but in providing evidence-based services. And so I applied for an NIH funded T32 postdoctoral fellowship, was fortunate enough to get 3 years of funding, and that allowed me to develop peers. And the phone has been ringing off the hook ever since. And then it
Mhm.
was adults looking for services. And so we're just trying to look for where are there gaps in service delivery, and again trying to fill them not just with anything, but with something that we actually know works.
Yeah, I mean, when you say ringing off the hook, that's real. It's real now. It wasn't just real when you were referencing. It's still today. We have an underserviced population, and that is adolescents. It is the late aged youth or young adults. Um, and there's a lack of providers out there that have tackled the service delivery. When we're talking about some of the areas, I mean, you are hitting on most of the social skills that are pertinent for somebody to be empowered throughout their lifetime. What are the components that are missing if we're not helping these young adults, we're not helping these adolescents? What are we creating? What additional barriers are we creating from them being able to access their community or their job world or relationships? What is it that we're missing here?
Yeah, I mean, unfortunately, if you look at the research and looking at outcomes for, adolescents and adults, we're finding that these tend to be pretty socially isolated individuals, and it's not that they don't want to have friends or romantic partners, it's just that they often don't know how to. And so some of them even give up. We typically see, youth that are either peer rejected or socially neglected. And peer rejected would be the ones that are actively seeking out their peers, but they're getting pushed away for some reason. They might be doing things that other people don't like or are uncomfortable with. And then you have the socially neglected who just don't even try at all. And in both cases, these are very socially isolated individuals. And we know that that social isolation often leads to greater mental health problems. So things like anxiety and depression, they go through the roof once you hit adulthood. When you look at folks on the autism spectrum, you look at that social trajectory. And a lot of the theories about why mental health increases, or those issues around mental health increase into adulthood, is lack of services and also social isolation. A lot of these young people are not actively engaged in school after high school. They either don't go on to post-secondary education or they are more likely to drop out. And it's often the social challenges that get in the way. Same thing true with employment. A lot of our adults, they want to have jobs, they want to be gainfully employed, but there's barriers there, and they're often social in nature, either having difficulty interviewing and going through that job sort of application process, or when they are employed, sometimes the social issues get in the way in terms of maintaining employment. And so, unfortunately, the outcomes are not looking good. And, one of my biggest concerns really is related to things like mental health, things like anxiety and depression. It's actually one of the reasons why I love this type of intervention, because I believe that when you're helping individuals, whether they're on this autism spectrum or not, when you're helping them to make and keep friends or to date or get a job, you're actually helping to improve mental health outcomes. And so this is a different approach to doing that. It's not giving someone a pill, or putting them in intensive psychotherapy. It's building skills that we know
Mhm.
are related to better mental health outcomes.
Yeah, I mean, and that's got to be the focus. The comorbidity rates are so high for
Yeah.
depression, anxiety, suicidality. I mean, all of these things really exist. And when we're empowered as individuals and feel good about ourselves and feel like we can take on the challenges that the society has put on us, and that we can actually go day to day and feel successful, that alleviates a lot of those mental health barriers that exist. So I'd love to kind of go, and I think we're going to go down two paths here. One is really going into what skills are being developed in peers. What is the focus? And then the other one, which I'd like to get into a little bit later, is how are we bringing the community along with us? Because you said that it's in schools. I'm sure that there's a parent involvement piece that I think you mentioned is in the training part. But let's start first with peers itself. What are those core social skills that peers is looking at that is going to enhance the lives of those receiving that training, that treatment?
Yeah, I think peers is often associated with friendship skills. That's where we started with this program. And peers, by the way, is an acronym. It stands for the Program for the Education and Enrichment of Relational Skills. So that, of course, can include friendships, but we also have programs focused on developing and maintaining romantic relationships. It's called Peers for Dating, or Peers for Careers is a college to career transition program and teaching employment related social skills. But, our flagship programs do tend to focus on friendship skills. And, friendship skills are different across the lifespan. We have programs from preschool to adulthood. But the programs that are probably most common are those that are focused on adolescents and adults because there are so few programs out there for that population. And so, related to those types of skills, we teach skills like conversational skills, really important for developing friendships, knowing how to be a good sport when playing games and sports with friends, knowing how to organize get-togethers with friends, and also how to handle different types of conflict and rejection. So whether it's an argument or disagreement with a friend, or working on changing your reputation in your school world, or even handling the different forms of bullying. And the research suggests that there's 4 different types of bullying. We'd kind of lump them all together when we talk about bullying, but really there's 4 very distinct types of behaviors. There's teasing, right? That's more verbal bullying. There's physical bullying. That's more physical and aggressive. And then there's also more indirect forms of bullying like cyberbullying and also rumors and gossip. It's more of like a social or relational bullying. And because those are 4 very different types of behaviors, we have very different strategies for combating those types of behaviors. So, friendships don't just focus on the development of friendships, but also the maintenance of friendships and also some of the conflict that can come within peer groups.
And it sounds like not only are you working on skills that will help somebody to work within the milieu and to build those closer, more trusting relationships, but it sounds like you're also hitting on something that has become a hot topic within the neurodiverse community, which is being able to truly represent oneself and be assertive to what I need and being able to communicate that effectively. Is that self-determination piece, is that a part of the curriculum as well, as far as being able to advocate for oneself?
Yeah, I mean, depending, of course, on the curriculum that we're talking about, that would be very different for, say, like a preschooler, for example.
Mhm.
But to use Peers for Careers as an example, or Peers for Dating, we do teach a lot of advocacy related skills that talk about sharing things like differences or a diagnosis, and helping people to better understand who we are and to accept us for who we are. And, I could get into all of the strategies that are involved with that, but the main message that I would say it's important to share here is that this needs to be strengths based.
Mhm.
We don't need to focus on all of these negative things that people often do when you talk about something like a difference or a diagnosis. Sure, there's differences, and it is important to point those out and explain those to others. And if you choose to put a label on that, that's fine. But also important, equally important, to identify what strengths come with those differences. And autism is a really good example of that. Yes, there are some challenges that individuals face, of course, on the autism spectrum, but there's also some incredible strengths. I'll
Hmm.
use, for example, that black and white thinking that you often see in autism and other types of neurodivergence. So it's sort of like very focused on rules, for example, following rules. And so, where that could be a challenge is in perhaps doing something I call it policing. Like one of the things, if you follow rules a lot, that means you also notice when people break rules. And
Hmm.
some autistic folks that I work with will sometimes feel compelled to point that out to other people. And we call it policing. And if your goal is to make and keep friends, you might not want to do that. People don't like that very much. But
Hmm.
that's a choice. That's a personal choice. But on the positive side of that kind of neurodivergence is that this is someone who tends to follow the rules. That means they don't tend to break rules. They don't tend to lie. This is going to be a more honest, trustworthy friend or partner. And that
Hmm.
trustworthiness is an important characteristic in many relationships. So that's a strength. And we need to focus on those strengths as well as some of the other differences that could be challenging and remind people why those strengths are an asset to that
Absolutely.
relationship.
And I think that that's something, whether it's in the classroom or in a clinical setting or in the home or the community, that we have to be able to teach those that are a part of that young adult's life or that adolescent's life about all these strengths. Um, but you had mentioned differences, and I mean, everybody would be entering into this program somewhere on their own life journey, and everybody has a different starting point. So, are the skills that are being taught in the peers program, are they are they limited? Are they, or do they really encompass the entirety of somebody's journey from childhood through young adulthood?
Yeah, good question. I mean, I feel like any program that tells you that it's sort of one size fits all, you should be suspicious about because nothing's really one size fits all, but it's a good start. These are the skills that we have found to be important towards whether it's making and keeping friends or developing romantic relationships, getting a job, whatever our goal is. But we always start with asking the young person, what is their social goal or what are their social goals, and identifying those social goals from the beginning. Number one, to make sure they're in the right place, that we can service those goals, but also that we're focused and that we're checking in about those goals. And that's so much about like the role of self-determination and making sure that really this is a good fit for this family, this person. And then along the way, kind of, checking in with those goals and making sure that we're meeting them. But giving people a core set of skills, I think, can be very helpful. And all of us are going to have our strengths and our challenges, whether we're neurodivergent or not. Some of the young people that come into our program have really great conversational skills coming in, and that's not going to be a big treatment priority for them, right? That's not going to be a big concern, but maybe they're having difficulty finding a source of friends, maybe going deeper into those friendships and managing conflict. And then others, they may be struggling with something different. So no one comes in, at the same place. But what we found is that in teaching this core set of skills to a group of people that go through this cohort together is very powerful and gives them that core set of tools that they need to develop and maintain meaningful relationships.
So, with that core set of skills that you're talking about, I'd love for you to illustrate the journey of somebody maybe that went through parts of the curriculum that were important to them and were empowered through that journey, and where that gave them more strengths within the overall community.
Yeah, well, thank you for that opportunity to share. I mentioned earlier that Peers is parent assisted, right? Or there's some sort of a social coaching aspect. And one of the reasons that that is so important is that we've discovered in this 2 decades of research on peers that really well-intentioned adults will sometimes give really bad advice in social situations. And I think it might be because for so many people, social skills kind of come naturally and they don't think about what they're doing. And so it's really easy to give advice that maybe they wouldn't even, follow. And a good example of this is in relation to teasing. And so, teasing is a issue for many young people. I mean, try to find one adolescent that hasn't been teased. That's just not possible. Everybody gets teased. It's how significantly, how severely you're teased that really makes a big difference. And we know that this is strongly linked to mental health issues, this chronic teasing and bullying. And so when you ask most young people what they're told to do, they're often told to do some things that are not what we would call ecologically valid. So ecological validity means that it's actually working in the real world. This is what people
Mm-hmm.
do. And okay, so I want to ask you, Jeff, what do you think most young people are told to do in response to teasing?
Either go tell an adult or let that person know that what they said was inappropriate or mean, or I mean, to advocate that way, but in a very scripted language.
Yeah, and we hear that as well. We heard like tell an adult or, tell them it hurts your feelings or something. And also we're told very frequently that they're told to ignore or walk away. And so then when we ask them if those strategies work, do you want to guess what they say?
It probably increased a little bit of the teasing, or it made the teasing something at times probably more aggressive, would be my guess.
Yeah, exactly. Those are not what we would consider ecologically valid. So let's walk through that. Like, let's imagine that someone's teasing me and I go tell a teacher, right? What's going to happen? Well, they're probably not going to get in trouble because it's my word against theirs. And I tried to get them in trouble, so now they're going to want to retaliate against me. So now I'm going to be
Hmm.
more teased by that. Okay, so let's think about another strategy. Let's tell them that I'm upset. Well, think about it. What is the teaser trying to get you to do? They're trying to get you upset. They
Hmm.
want you to get upset. That's fun for them. So you're actually making it fun for them. And of course, in this case, I'm more likely to be teased. Now, if I ignore them, what are they going to do? They're going to keep teasing me, right? And I made it easy for them. So again, I'm more likely to get teased. And if I walk away, what are they going to do? They're going to follow me and keep teasing me. And again, I'm more likely to be teased. I made it so easy. These are not ecologically valid. So, in looking at the research to figure out, well, what do kids who are able to escape teasing do? It's actually very simple. It's probably the simplest skill that we teach in peers. They really just do this thing where they give a short comeback that shows that what the person said didn't bother them. And what they said was maybe even kind of stupid. So they'll say things like, whatever, or yeah, and am I supposed to care? Is that supposed to be funny? And your point is, they'll roll their eyes, they'll shrug their shoulders, and they act like what the person said didn't bother them. And that
Hmm.
makes it not fun for the person who's teasing them. It actually even embarrasses them a little bit because you're making it seem like what they said was stupid. Now, let me ask you a question, Jeffrey. Do you have to be autistic to benefit from learning that skill?
Absolutely not.
Absolutely not. Do you think every kid should probably learn that skill?
Yeah, I think that it's probably something that will increase the self-esteem of almost everybody in a social situation.
Exactly. And self-esteem is so, so strongly linked to things like peer rejection. You're absolutely right. And mental health as well. Peer rejection and teasing are some of the strongest predictors of things like depression and anxiety, poor self-esteem, substance abuse, school performance, and even suicidal ideation. We need to do more for our kids. And it's not even just our autistic kids, it's all kids. So that's an
Hmm.
example of how we would teach a skill in peers. Of course, we need to practice that and have them, practice outside of the group. And I'm thinking, you asked of a specific example. I'm thinking right now of a young boy that went through our program years ago. He was about 13 and he was viciously teased and bullied
Hmm.
as a child. He was more of a peer rejected kid where he was actively seeking out his peers, but he was getting pushed away. And he became incredibly depressed as a result, and then started to withdraw and then started to look more socially neglected. He wasn't even trying. And when this kid came into our program, he had been in and out of numerous psychiatric units and been hospitalized numerous times for suicide attempts. Had a really significant history of depression at this point and anxiety, and had been on pretty much every psychotropic medication you could think of, and nothing was working. And he came to Piers with his mom and, feeling pretty discouraged, but he took the program really seriously. They did the homework assignments, they showed up every week, and he was doing well, and he was starting to develop friendships. And you could see his sort of like his affect was kind of changing, and he seemed happier. And by the end of the program, it was sort of like he had blossomed into this new person. And he came up to me at graduation and he said something to me that I will never forget. He told me the story of what I just told you about being in and out of hospitals and being on all these medications. And he said for him, friendship was the best medicine.
Oh, I'm
And I
sure.
loved
Yeah.
that. I mean, it's not a cure-all. Don't ever believe anyone who says that something's a
Hmm.
cure-all. But for him, that's what he needed. That was the key. It wasn't being on all these different medications, and it wasn't being in these psychiatric units. It was he just needed some friends.
Hmm.
And so I think that that kind of underscores the power of friendships. Again, it's not a cure-all. We're not telling people to go off their medication or anything like that, but it does show you the importance, at least in this one kid's life, of
Well,
just having a couple of friends.
I think that follows the research. When you're looking at happiness in general, it's social belonging. It's so important in forming our own identity and who we are and being happy with our life experiences, is having that social network and that feeling that I have a place. Um, but I love the fact that, and I guess I didn't know this, but the it sounds like the research that you all are incorporating into it being so ecologically based, it's looking at, the natural environment, like what actually is happening. If I look at a teenager in a high school situation, those that were successful did this. And it sounds like you're incorporating that into all the strategies. Is it really kind of focused on, this is real life. I'm going to find the right response based off real life conditions.
Absolutely. I mean, when we developed this, or I developed this program years ago, I was looking at not only what were some of the social challenges that young autistic individuals face, but also what was working for other people that were successful in making and keeping friends. And so looking at both. And often we can find that in the research literature, whether it's not always in psychology, sometimes it's in
Mm-hmm.
sociology or anthropology. And then sometimes the social world is changing so rapidly that the research can't keep up with it. And a really good example of that is things like online dating or electronic communication. And in that case, we have to get a little creative in how we figure out what's ecologically valid. And we do focus groups with people who are successful in these different social arenas, or and even some of the online dating apps are doing their own research to help
Mm-hmm.
people in these situations. So it's looking at it from multiple angles, and also recognizing that the social world is constantly evolving and changing.
Yep.
And so I never think of the manuals and the curricula that we published as finished. They're
Mm-hmm.
working manuals. They're constantly changing. They're always evolving.
Yep. And I mean, just looking at even my life, it's things have changed so much, and even in the business world, things have changed in the way that you're working with your colleagues and your those that are in a manager employee relationship. Like those things are so different, and if you're not understanding the social nuances, is that you start feeling less successful and that you start being more withdrawn because you don't want to keep failing. And that's similar, I think, to these social relationships that you're describing with these young adults and adolescents going through the program. When you are teaching, I always think of this as, you have some of the skills that I need to empower an individual with to be successful adapting to their community. But on the flip side of that, I look at this is what the community needs to understand how to make sure that I have an inclusive environment that's looking at everybody's strengths. How does the Peers program mirror that?
Yeah, thank you for asking that question because it is such an important point. I spent the first 2 decades of my career developing these curricula that help neurodivergent youth and also youth that are not neurodivergent. This program is not just for autistic youth, it's for anybody who wants to learn the skills that we have to teach. So just important to point that out. And it's not just autistic youth that are struggling socially. But I spent the first 2 decades of my career just trying to decode the social world. And that's not, a small thing. And now my hope is, if I'm lucky, spending the next couple decades helping the social world to be more inclusive of people who may think differently or behave differently. And we're doing that in our work, for example, in Peers for Careers. So this is a college to career transition program. And it not only teaches skills related to finding and maintaining employment for neurodivergent job seekers, but we also work with employers on creating a more inclusive work environment and really highlighting the importance of and benefits of hiring neurodivergent workforces. I mean, this is something that, a lot of large Fortune 500 companies have been exploring for some time, but we really need to take this to all levels of employment. And I think that that's a really important point. I think that we could do more in this arena, not just in the area of employment, but also in other types of relationships that people have, including friendships. And I think
Yeah,
school
absolutely.
environments are probably the best place to do that.
Now, and I always look at that as that I hope that schools see the benefit of, how do I bring up everybody through these programs? Because it's not just the person that might be enrolled in the class that's going to benefit. It's every single person that touches the lives of anyone who's going through a journey that will become a better person, a better friend, a better component of that social dynamic if they are open-minded, aware, and that they're willing to grow with people versus being isolated from it. How do you go about training? I mean, so this is a program you've dedicated so much time, so much energy, research into. I'd hate to think that it's not out there. I know that you're in 150 different countries and that you have so many different folks that are certified, but there's got to be more out there that are like, hey, I just heard this. I want to bring this into my world now. How do they go about getting trained?
Well, we have multiple avenues for doing that. I mean, I do have published curricula that anybody can access, in places where books are sold like Amazon or wherever. And that's certainly fine. We also have 3-day certified training seminars that we conduct virtually to make it more accessible to people. And we do those every other month at UCLA. And that's an option too for professionals that are looking to develop a peers program in their community. We also have other materials on our website, including a role play video library of over 100 role play videos that focus on the skills that we teach in peers. We have a free app that you can find for both iOS and Android devices that teach a lot of the skills that we teach in peers. So we're really doing our best to disseminate peers as widely as we can. But it's always a process. It's something that often involves a bit of training and that is time consuming and requires resources. So if someone's not able to attend a training, at least accessing one of our manuals would probably be a good start. Going back to the importance of ecological validity in what you're teaching, you don't want to be one of those well-meaning adults, those well-meaning professionals that give kids advice that's just not sound. I use the example of handling teasing. How many adults that are listening to this podcast right now have told kids to ignore, walk away, tell an adult in response to teasing? I would have done that too if I hadn't read the research. So really making sure that at the very least, the advice that we're giving kids is going to be helpful.
And it sounds like it's iterative, is that, over time, as that social dynamics change, social situations start to vary, even what you're running into, is that this is going to be a moving
Yes.
process. When you're creating, I mean, you started with probably one product that's completely kind of grown and evolved. Like you said, you have apps, you have other technologies that are out there. Are there other areas that you see that, there's still a need? I haven't gotten to tackle it myself yet. There's still a need. Is that whether it's virtual reality, whether it's being able to kind of expand the scope of who you can reach? Like, are there areas that you're hoping to push into?
Yeah, I mean, some of the areas that will be newer to our community will be things like the Peers for Preschoolers intervention. I've been testing this intervention for over a decade. So it's not new to me, but it will be new to our community. That manual is coming out this December. We're very excited to provide trainings around that. Peers for Dating and Peers for Careers, we're currently testing those through randomized controlled trials. So those are also not accessible to the public yet, but will be in the future. And so I'm very excited about those. You mentioned virtual reality. I'm working with a lot of people in the tech industry around creating virtual platforms to not only teach these skills, but practice them as well. We have some pretty socially anxious young people who maybe aren't ready to practice some of the skills that we teach in real life, but maybe are more willing to do that in a virtual setting. So that's sort of exciting to explore that new frontier as well.
Yeah, and as you roll out all of these new products and these iterations, where can folks go? What's the easiest way to be able to kind of know, hey, this is where all those resources are. This is how I can access them. This is the website. This is who to reach out to. This is how to make sure that whoever I'm with can take advantage of all the work that you've done. Where do they go? What's the starting point?
Yeah, there's so many ways to reach us. I mean, there's certainly our website, which if you just Googled UCLA Peers Clinic, you would find us pretty quickly. But the website's semel.ucla.edu. We also have a pretty active social media, so you can also just look us up with our handle UCLA Peers, and then anyone could also email us at peersclinic@ucla.edu. But we try to stay pretty active again on our socials to make sure that whatever resources are available to our community, that they can access them pretty easily, and stay informed.
Well, I for one appreciate all the work that you've done, and I see it also as a vehicle right now, is that a lot of service is not focused towards the population that you're talking about. It's you have a lack of number of clinicians out there, and it's trying to help expand that service delivery platform so that more and more people feel empowered to touch the entirety of our population to be able to provide that service. And I think that peers will do that. I think that it'll give more access to so many more people, especially if clinicians are listening. Is there anything else that you want to put out there that maybe I've forgotten, just to be able to kind of have our listeners think about the impact that incorporating peers into your program could provide them?
Yeah, I think that, a lot of times when people think about social skills, they often think of it like an art form or something, like something that you're either born with and you have it or you don't, and it's just something that comes naturally. And for some of us, we may be lucky enough that it sort of comes naturally. We learned it somewhere. We maybe just didn't know we were learning it at the time. But we actually in the Peers Clinic at UCLA, we really think of social skills as more of a science, something that can be taught, skills that can be broken down into concrete rules and steps that people can follow. And we haven't talked about this, but there's a great importance in making sure that people actually want to learn the skills. We should never be forcing these types of programs onto people who don't want to learn them. That's not really ethical. And I've been preaching that for decades. It's not ethical to force these programs onto people who don't want to learn them, but it's also not ethical to withhold these programs to people who want to learn them. But I think it's important to also recognize humbly that we all could benefit from learning these skills. Try to find one parent, for example, that has gone through our program that hasn't learned something that they're also utilizing in their own social world. We can also all benefit from learning these skills, and they can be learned, they can be taught if someone wants to learn them.
So well said. And once again, I appreciate you coming on and sharing your experience and your knowledge with us. And I think so many people will take advantage of it. So thanks again, Dr. Laugeson.
Well, thank you again for the invitation.
Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Google Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.